Do ketogenic diets cause atrial fibrillation? Well, some people mistakenly believe this to be true. After all, the American College of Cardiology says it's so, right? But here's the problem. They're wrong. And it isn't hard to understand why. So let me explain. Welcome to Metabolic Mind, a nonprofit initiative of Bazooki Group, transforming the study and treatment of mental disorders by exploring the connection between metabolism and brain health. Thank you for joining us on this journey. Before we get into the details, please remember our channel is for informational purposes only. We're not providing individual or group medical or healthcare advice or establishing a provider-patient relationship. Many of the things we talk about, including ketogenic interventions, can be potentially dangerous if done without proper clinical supervision, so always consult your healthcare team before changing your diet or medications. Also, ketogenic interventions may not work the same in everybody, so please understand there's not one universally accepted response. We did a recent video exploring the medical and dietary community's inherent bias really against ketosis. But here's one we didn't include. Does ketosis cause atrial fibrillation? And again, why does this even matter? Why are we talking about it? Well, it matters because ketogenic therapy, usually starting with a ketogenic diet, is a powerful treatment for multiple medical conditions, including metabolic dysfunction and type 2 diabetes and numerous brain-based disorders such as epilepsy, dementia, and mental health disorders like bipolar disorder, major depression, schizophrenia, and more. Clinical experience and emerging research point to a clear and profound benefit for many people using ketogenic therapy. And while not everyone responds the same, it's a treatment that has been life-changing and life-saving for many individuals. But what if someone was discouraged from trying ketogenic therapy because they were concerned about an increased risk of AFib or atrial fibrillation? Could they be missing out on a treatment that's actually safe and effective because of a misunderstanding of how to interpret nutritional studies? I would argue absolutely yes. So first, what is atrial fibrillation or AFib? It's a heart rhythm disturbance that can lead to feeling palpitations or lightheadedness, exercise tolerance, or at its worst, heart failure and stroke. So it's a serious condition that deserves attention to how to prevent it and treat it, right? And if ketosis made this more likely, I would absolutely want to know that so I could have that discussion with my patients. So where did this misunderstanding come from? Well, back in 2019, the American Heart Association journal, AHA journal, published a study that concluded those following low-carb diets were more prone to atrial fibrillation. Now, sounds pretty scary if you're following a low-carb diet, right? But as you can see here, the lowest quartile for carbohydrate consumption was 37% of their calories. On a 2,000-calorie diet, that's 185 grams of carbs per day. Now, those who know about ketogenic therapy know that most people eat around 20 or 30 grams of carbs per day, and there's virtually no chance that someone eating 185 grams of carbs is in sustained ketosis. So it's important to realize that this study has absolutely nothing to do with ketogenic therapy or a ketogenic diet. And it's crucial to understand that low carb is not the same as ketosis and should not be compared to it, as they are completely different physiologic states. We did an entire video on this, so you can learn more. So really, we could probably just stop there, right? And realize that saying ketosis increases AFib is simply wrong because it's based on this study. But it's important to point out that there are other flaws in the study. For instance, those eating lower carb smoked more and drank more alcohol compared to those who ate more carbs. So guess what can increase the risk of AFib? Well, if you guess smoking and drinking, you're right. So here's a thought question for you. What if we designed a study looking at people who ate more vegetables, who also smoked and drank, and compared them to ketogenic eaters who were metabolically healthy, exercised regularly, and didn't smoke or drink? And lo and behold, we found that the vegetable eaters had a higher incidence of atrial fibrillation. Would we see headlines that said vegan diets cause atrial fibrillation? Well, I would hope not, because one, just because you eat vegetables doesn't mean you're vegan, but two, given the healthy user bias, there's no way we can conclude that the vegetables cause the AFib, since they were just inherently less healthy at baseline by drinking more, smoking more, and probably having other unhealthy life habits. Now, that may seem like a silly example until you realize that's almost identical to what happened in this case, except in the reverse. So chalk this one up to another example of bias against ketosis and a misunderstanding that ketosis is actually a physiologic state, not a diet. And that physiologic state requires your body to shift from burning carbs from fuel to burning fat for fuel. And this doesn't happen at 185 grams of carbs per day. In addition, people can achieve ketosis with many versions of properly formulated diets, including vegan and vegetarian, Mediterranean, and others. So let's all try to be a little bit more aware of how ketosis is misrepresented in medical and dietary communities, and know that most of the headlines have no relevance to ketogenic therapy. I hope that was helpful. If it was, please like and subscribe, and please share this content with those who you think may benefit, and leave us a comment about other misunderstandings and misconceptions about ketosis, and maybe we can create content to delve deeper into those. Thank you for watching. We'll see you here next time at Metabolic Mind, a nonprofit initiative of Bazooki Group.